I'm going to go to each of our doctors who will make a statement too and give a few thoughts. So let's go first to Dr. Brad Archer, who's the Chief Medical Officer at Monument Health. Dr. Archer?
Thank you, Governor, and thank you, Josh, for the opportunity to collaborate during these challenging times on this particularly confusing topic of predicting the course and impact of this virus. We at Monument Health endorse this model, and we appreciate the opportunity to have our predictive analytics team engage with each of you as we came to this conclusion. The use of these models, their utility really is primarily in building out our capacity plans and also to look ahead to make sure that we have the supplies that we need to deal with this. Those have been the primary efforts that we've been engaged in for the last several weeks. We've redesigned really our entire organizational structure to do just that. We've had great interaction with our local elected officials as well as other community agencies, including health care providers, as well as our engineering community that has stepped up to help us with manufacturing and recycle and reuse options. So we appreciate the opportunity and hope to continue this collaboration across the state.
That's great. Thank you, Dr. Archer. Let's go to Dr. David Basel, Pediatrics and Internal Medicine at Avera.
Thank you. On behalf of Avera, I'd first like to start by thanking you, Governor, Secretary, and Dr. Clayton for bringing us all together to have open dialogue and discernment in this process. What a state that we live in, that there are not very many states where all of the major players can come together with this degree of dialogue that we've had in these last couple of weeks to come to these projections, which Avera also fully supports. The thing that has really reached me during this process, and you showed that in that first graph that you showed, the difference that each and every individual resident in this state is going to have. We do not have a vaccine for this virus. We do not have an antiviral treatment for this virus. What we have to fight this virus is each and every resident. The difference between each resident infecting 2 other people versus 2.5 other people means the difference between the healthcare systems being able to handle this load or being overwhelmed by this load. And so the power really is in the people's hands, staying home. If you have any hint of illness, not being around other people, that social distancing will determine whether we win or lose this fight.
That's very good. Appreciate that. Dr. Allison Settle, Chief Medical Officer at Sanford Health.
Thank you, Governor. I would also like to reiterate my sincere thanks to the Governor, the Secretary, and Dr. Clayton. It has been a collaborative effort, and it has been wonderful to see all of the systems come together and with the state to come up with one story that we can tell South Dakota, and that we can all now shoulder to shoulder prepare and get our arms around so that we can take care of every single resident and every single patient that comes to our doors. So it's been fantastic, and I really do appreciate those efforts. Next, I would like to say thank you to every single one of you in the state of South Dakota who has done your part to social distance. I have physicians and nurses that are coming to work every day, and they're given time to prepare, time to plan, and time to get the supplies we need and get the medications that we need so that we can take care of patients. And so thank you on behalf of every single physician and nurse that works at Sanford for staying home and doing your part.